Welcome to Turning 65, Now What? I'm Bernadette Baugh, owner and agent at Blaze Senior Concepts. We're an independent agency that focuses on helping individuals navigate the world of Medicare. We are not associated with Medicare. We are licensed and certified independent agents that work year-round on helping people with Medicare products, understanding how they work, understanding what fits well based on a person's unique situation. Today, we are going to tackle, so to speak, the 2025 prescription drug changes that are set to occur here in about a month or so. I'm recording this early September of 2024. The changes will affect the annual enrollment period that begins October 1st. All the information that we discuss is all based on legislation that has been passed. We'll get deeper into that, but there are not going to be any plan-specific details. All of that has to wait until October 1st when it's released. So everything on the Medicare Part D side is heavily regulated by CMS, or the Center of Medicare and Medicaid Services. So we won't be talking specific plan information, just a high-level overview of why these changes are occurring and what we can expect. So let's dig into it. We're going to talk about overview of changes to the Medicare Part D program. This is going to include if you have a standalone prescription drug plan, meaning you have a separate ID card that you give the pharmacist when you pick up your prescriptions. And it's also going to include a Medicare Advantage plan that includes prescription drug coverage in it. So that's where you have one card, you give that one card to the physicians, pharmacy. If you have dental, vision, extra benefits, you just have one card. That's a Medicare Advantage plan. We'll look at newly defined standard Part D design. The Medicare prescription payment plan, which is new. This is something that I believe is brand new to the health insurance industry pretty much as a whole. So it's a really different and unique concept. We're going to dig into the details of how all that works, and then some final tips and takeaways. Don't forget, if you haven't already, make sure you like this video, subscribe to our channel, share this video with your friends and family. It's really important, especially for this video with the Part D changes for 2025, that people that are Medicare beneficiaries, have Medicare, be aware of these upcoming changes so that they can begin to prepare both mentally and a timeline as far as this annual enrollment period, because there are going to be some big changes. So we'll get into it, but make sure, like, subscribe, share, and let's start talking about this. So these changes are all a result of the legislation that was passed in the Inflation Reduction Act, or IRA, of 2022. Within this act, there were really a lot of clean air incentives, including home energy, clean vehicle credits, lots of green initiatives, but also included were some changes to Medicare. And these changes actually have proven to be some of the most comprehensive changes to the Medicare program since the implementation of Medicare Part D back in 2006. So we're looking at, 20 years ago, we had approximately the implementation of Medicare Part D, your prescription drug coverage. And from there, we've had little changes here and there, but this one is a significant one. So let's talk about what was all included in the Inflation Reduction Act as it pertains to Medicare changes. Effective January of 2023, they implemented the $35 insulin cap. So this is where an individual that was covered under or is covered under a Medicare Part D plan has access to insulin medication that is capped at a $35 copay for a 30-day supply. So that happened back in January of 2023. It also started in January 2023 that certain vaccines would be covered at 100%. The main one that I run into is the shingles vaccination. Before 2023, the shingles vaccination was covered under your Medicare Part D plan or coverage. However, if your plan had a deductible and you hadn't met your deductible, the shingles vaccine would be applied toward your Part D deductible. And again, if you hadn't met your deductible at all, or just a very small portion of your deductible had been met, it felt like that individual had to pay out of pocket for that particular vaccination. So beginning in January of 2023, some vaccinations are now covered at 100%. In 2023, the government, Medicare, began negotiating pricing of 10 medications. We're not going to get into that, but that recently was solidified earlier in August. So that's kind of a whole different topic, and we're not going to get into that. But that's when the negotiation of the first 10 medications began. It also included some drug manufacturer inflation rebates. Again, we're not going to get too deep in the weeds with some of this, but that was what was included in what began for 2023. 2024, so the start of this year, there was the expansion of the Extra Help program. Individuals that qualify typically due to an income amount, that is a program that helps those individuals pay for their medications, helps make their medications more affordable, I should say. And the elimination of the co-insurance phase during the catastrophic, or elimination of co-insurance during the catastrophic phase. So essentially for 2024, the prescription drug program many times will have a deductible. Then you would have your co-pays once your deductible is met, which is called your initial level coverage phase. Then it would go into the coverage gap or donut hole after a certain dollar amount between you and your plan has been paid out. And in years past, after you met the coverage gap dollar amount, an individual would actually then go into the catastrophic phase, which meant that they still paid for their medications, but it was typically at the lowest cost for the year. So for 2024, that catastrophic phase, a person does not pay towards their medications once they're in the catastrophic phase. Again, we're not going to get real deep into the weeds on some of this because we have a lot of information to tackle, but it's important to see that that particular piece did change for this year. If you're not taking high cost medications, you won't or wouldn't notice that change. If a person's taking high cost medications, especially right around this time frame, usually around September, October is when a person would hit the either the coverage gap or catastrophic. So but what this video is concentrating on, and we really want to get into the details of, are the changes for January 1st of 2025. The big one is that there will be a $2,000 out-of-pocket cap on your cost of medications, what you're paying in copays. This is going to include, again, if you have what we call a standalone prescription drug plan. That's a plan or coverage where you have a separate ID card just for your prescriptions. Okay. It's also going to include your Advantage plan. If you are able to get medications through your Medicare Advantage plan, you have Part D coverage included with that. For 2025, January 1st, there's also going to be the implementation of the prescription payment plan. So let's start looking into this. To give us a good idea of how to compare the changes, we're going to take a look at current Part D plan benefits. So there's a Medicare standard drug plan. This is your baseline coverage where that CMS sets each year. So this is just kind of the basic plan. If a health insurance company is going to offer a Part D plan or coverage, they have to include at least these standards. And then they can also include a basic plan design drug plan, which that is usually a lower cost option premium wise. And so these are the lower cost premium plans that you may see in your area. There also typically is a third option that an insurer will offer, and that's called an enhanced alternative drug plan. These plans typically have a higher monthly premium. They may actually eliminate the deductible. So an individual that's taking higher cost medications doesn't have to meet a deductible first. It can go right into a copay amount, which a lot of times is attractive for individuals that are maybe taking higher cost medications. Many times, if a prescription or if an insurance carrier is going to offer prescription drug coverage, Medicare Part D coverage, many times they will have these three options: your standard, your basic, and enhanced. There's a very good chance that this particular amount of plans will change for 2025. We're anticipating that insurance carriers may reduce the number of plan options going into 2025. Currently, the Part D, so for 2024, the Part D plans, Medicare Part D plans, have 4 coverage phases. Your deductible, which Medicare determines the maximum deductible amount each year. This year it's $545. Your initial level coverage phase, that's after you meet the deductible. You are going to, typically it goes down to either a copay amount, a dollar amount, or if it's a really high cost medication, a coinsurance percentage. After you and the plan have paid $5,030, a person will enter the coverage gap. That has been in the past the phase of coverage where an individual will pay the most for their medications. However, Medicare's been working hard to eliminate or reduce that coverage gap. So really now, depending on the medication you are taking, you may see where the cost increases a little bit. Sometimes you may even see where the cost decreases due to a manufacturer's discount. And then finally, the final phase, which we talked about, is sort of eliminated for 2024, and that's the catastrophic coverage, where a person will now, for 2024, not pay any additional copays or money for the rest of the year. These plans always reset come January 1st. The new 2025 standard drug plan phases. So this is the new standard drug plan and how it's going to look for 2025. There will be a deductible phase. Medicare has already announced the maximum deductible amount is $590 for 2025. Depending on your plan, there is a good chance that an insured will need to pay the full cost of their medications up to their deductible before the plan begins paying. Again, we're not going to get into plan specifics, so this is just a generality of how the plan will work. Not until October 1st will we get full plan designs, and then at that point you'll be able to run an analysis, or you can work with your agent in running an analysis of your medications, comparing them to the plans that are offered to determine a good fit for your prescription drug coverage. After the deductible phase has been met, then you will have the initial coverage phase. This is where an insured pays 25% coinsurance for all covered meds. Again, this is the standard drug plan. So if an insurance carrier offers a different type of coverage, you know how we looked at those 3 different plan types, then you are on or insured by one of those plans, it may look a little different. But this is the standard drug plan. You would pay 25% coinsurance for all covered meds. Now, you will continue to pay your coinsurance amount until you've reached a annual true out-of-pocket of $2,000. What's also new in the initial coverage phase is the payment plan option that you would elect through your Part D insurance company or carrier. Catastrophic phase is still there, but the insurance company and the manufacturer of the medications are going to pick up the remaining prescription drug cost if an individual goes over the $2,000 threshold. So as a Medicare beneficiary under a Part D plan, you're not really going to feel that. Once you hit your $2,000 out of pocket, then your medications will be covered at 100%. That being said, it's really important to understand that that $2,000 threshold only applies to medications that are covered under your plan. So if you have a medication that is not covered by your plan and you go ahead and fill it, those dollar amounts for that particular medication are not going to go towards your $2,000 out-of-pocket maximum. So it's only towards the $2,000 out-of-pocket maximum medications that are covered under your plan. That's really important. Hey, this is, I'm including some visuals because I'm a visual person. I like to be able to see things kind of spelled out in multiple ways. So here's a chart. It shows that you have the deductible stage, okay? Then you have your initial coverage, and then your catastrophic. Everything will reset come January 1st. So these plans are always calendar year plans. And that's how it is currently. Always calendar year. New coverage begins January 1st of each year. So let's compare the two because it is nice to be able to see how the current coverage is compared to what's changing. We can see the deductible is going up a bit. Again, your initial coverage phase, you're going to be capped at that $2,000 in true out-of-pocket costs, what you are paying for your medications. This cap does not apply towards out-of-pocket cost for Part B, as in boy medications. Many times your Part B medications are those that are administered through an infusion, very high cost. A lot of times that infusion occurs at a doctor's office or a hospital, okay? So this is just retail meds that you're picking up at the pharmacy. Eliminated, no more. After you go through your initial coverage, we don't have the coverage gap. And really, the catastrophic coverage is still there, but you're not paying towards it. So you can see that the insurance carriers, comparing some of these costs into 2025, are going to be absorbing a significant amount of expense from what they're used to. Up until 2025, these plans, well, here in 2024, we did have an $8,000 true out-of-pocket cost due to the coverage gap and the catastrophic coverage being covered at 100%. But outside of that, there really wasn't a cap on the cost of your medications under a Part D plan. So now we are going from no out-of-pocket, essentially, cap, to just a $2,000 out-of-pocket cap. So this is resulting in a pretty large burden of expense going on to the insurance carriers that offer Part D plans. What we are anticipating changes to the standalone Part D premiums. So again, a person, you can have two different types of coverage for your Part D. You can, again, have a standalone prescription drug plans. Many times that's partnered with a supplement. So it's maybe to help if you show your Medicare card, your supplemental ID card, and a prescription drug card, you have a standalone prescription drug plan. Okay, if your Medicare coverage, if you only show one insurance card, you don't even show your Medicare card anymore, you just show your one Medicare plan card, then you are covered under a Medicare Advantage plan with prescription drug coverage if you're able to go to the pharmacy and your plan covers that. So right now, let's talk about changes we are anticipating to standalone Part D premiums. These are the plans where you have a separate ID card for. Experts are predicting an increase in Part D premiums. Again, the companies that are offering these Part D plans are absorbing a lot of cost. Now, the Part D insurance companies that offer Part D plans have to bid their plans, so send the information of the plans that they're going to offer to CMS. So all of this is heavily regulated. But these plans are absorbing a lot of expense. The insurance carriers are expecting this cost to increase by 40% or more from current 2024 plans. Experts are also anticipating a possible reduction in the number of standalone Part D plans being offered in 2025. What we need to keep an eye out for are insurance carriers or companies that maybe are exiting the market, okay, meaning they're not going to offer Part D plans, period. We also need to keep an eye out for insurance carriers that perhaps offered 3 different prescription drug plans in the past, and now they're only going to offer 1 or maybe 2. Let's talk about if your insurance company that you currently have a Part D plan with is exiting the market. It's extremely important that you make sure during this next annual enrollment period that you find a prescription drug plan that meets your needs and you enroll in that plan during the annual enrollment period so that you have coverage beginning January 1st. Keep an eye out for information from your insurance carrier that's going to be mailed to you. They'll make you aware of it, but of course we all know during this fall time frame, you're getting mailers from every insurance company across the nation. So, but really keep an eye out for your current insurance carrier. That's the name on your ID card, and make sure that you become very knowledgeable on what is happening within your coverage. If an insurance carrier is still going to be in the market, but maybe they're just reducing the amount of plans offered, if your plan is not going to be offered, most likely into 2025, most likely if you do nothing, you will automatically be rolled into a Part D plan that is covered by that insurance carrier, or offered, I should say, offered by that insurance carrier for 2025. Okay, if you don't want that particular plan, you're going to need to go and enroll in a new plan during the annual enrollment period between October 15th and December 7th so that your new plan begins January 1st. We're also anticipating changes in formularies. That's the list of medications and how expensive each medication is. Essentially, the formulary is your list of medications that's covered under your Part D plan. All Part D plans have to include at least 2 medications within every therapeutic class of meds. So these plans all include a wide variety of medications. Many times they offer more than just 2 medications within every therapeutic class of meds currently. Next year, we are anticipating that the number of medications covered under a plan may reduce a bit. The tiers, so that is where the medications that are covered in the formulary, the list of medications covered, they are grouped into buckets, essentially, based on expense. So tier 1 would be your lowest cost medications, tier 2, a little more expensive, tier 3, tier 4, tier 5. So keep an eye on medications that maybe you're not paying a whole lot for currently, may actually move a tier to a higher cost tier where you may be responsible to pay a higher copay. We also anticipate that we will move away from copays, that's just a flat dollar amount for a medication, more towards coinsurance, which would be a percentage of the cost. Again, it will be capped at $2,000 for the calendar year, but these are all things to become aware of potential changes that may happen within your current Medicare prescription drug coverage. We are looking at standalone Part D right now. Recently released, so CMS recently released a Part D Premium Stabilization Demonstration Program. This is a program that is going to help offset the anticipated increase in premiums for Part D plans. The program, each insurance company that offers a Part D plan has to say yes to participating within this demonstration program. If they say yes, then this demonstration program will last at least 1 year, up to 3. And again, essentially it's subsidizing premium to subsidizing dollar amounts to help lower the overall premium of a standalone prescription drug plan. The problem with that is that it's not doing anything to address why these prescription drug plans are the cost is increasing. The cost is increasing due to the legislation that was passed in 2022. So with this stabilization demonstration program, we're really just, for lack of a better explanation, kicking that premium hike down the road a bit, kind of bandaging it up a bit. But at some point, it's not going to be subsidized anymore, most likely, and we will see premiums increase unless new legislation is passed that will help stabilize this a bit more overall. Okay. Changes to Advantage plans with Part D coverage. An Advantage plan with Part D coverage, again, this is if you have a Medicare plan where you just show your one Medicare card, health plan card, and it covers your medications along with the same card that you showed for doctor's office visits, lab work, hospitalization. For these plans are going to be a little less impacted, we are guessing, because instead of with a standalone prescription drug plan, you have just the prescription drug coverage that plan is including. So any changes, any added expenses has to be absorbed all within that little plan. With a Medicare Advantage plan, prescription drug coverage is just a part of the overall coverage that plan offers. You know, you have your office visits, you have lab work, hospitalization, outpatient surgery, therapy. All of those benefits are included under a Medicare Advantage plan. So with those plans are going to have a bit of an advantage, really, it seems, because instead of seeing a huge change just in the Part D, they can take that expense, they being the insurance company, can take that expense and make little changes throughout the whole Advantage plan coverage or plan selection. So what we may see with that is you may see some changes in copays. If you pay a certain copay this year, you may see where that copay is increasing a bit for next. You may see an addition of deductibles, both on the medical side and the prescription drug side. You may also, we're anticipating some changes in non-core benefits, such as the over-the-counter allowance, where you get a certain dollar amount to pay towards the purchase of over-the-counter items. A grocery allowance, we may see a change with those, fitness benefits, and so forth. We are also anticipating a possible reduction in the number of plans on the Advantage plan side that are going to be offered starting in 2025. So again, it's really important to become aware of who your insurance plan is who the insurance company is that administers your plan. If you have a Medicare Advantage plan, keep an eye out for any information that is being sent by your insurance carrier, because it's going to be communicated either by mail, if that's what you've elected, or by an email notification if you've gone paperless. So you need to make sure your plan is still available. You need to make sure, if it is available, that you look at the annual notice of changes, or ANOC, where it shows current plan benefits, and then it also showed the upcoming 2025 plan benefits. Make sure you read through that and look through any changes that may occur. This is on the Advantage plan. Individuals that have an Advantage plan, it's going to be really important to work with your agent, make sure that all of that lines up accordingly, especially if maybe you haven't reviewed that in a year or two. Because there are going to be changes that we are anticipating. So it's really important, if you don't have an agent, find someone local that can help walk you through some of these details to be aware of. Let's talk about the Medicare prescription payment plan. This is a big change, big change, and it's adding a lot of expense for a Part D insurance company. The Inflation Reduction Act requires that all Medicare Part D plans, both standalone and Advantage plans with prescription drug coverage, that they offer Part D enrollees the option to pay out-of-pocket prescription drug cost, your copays, in the form of capped monthly payments instead of all at once at the pharmacy. So what does that mean? That means that you essentially will have the option of a payment plan if you so desire through your Part D insurance company. Now, it is a program where you have to enroll in. So you will have your prescription drug plan coverage. You're enrolled in that plan. If you want to enroll in the prescription payment plan through your insurance company, that's going to be a second enrollment. You're going to have to enroll in that program. It's available to all, though it probably won't be beneficial for individuals taking low-cost medications. It's really anticipated that this is going to benefit those that are taking a medication that is at least about $600 retail cost a month, because the idea behind this program is that now the Part D plan coverage has a $2,000 out-of-pocket maximum, but the legislation within the Inflation Reduction Act wanted to prevent an individual from having to pay $2,000 out of pocket all in January due to the expense of their medications. So what this program does is takes into account your anticipated cost of medications for the entire year. We'll divide that by 12, assuming a person enrolls for January. And then the individual that's participating in this plan, will be billed separately for your prescription drug cost by the insurance carrier, and it'd be a monthly billing notice. Okay, so you will have most likely your prescription drug plan premium that you pay monthly just for having the insurance. Okay, and then if you enroll in this plan, you're going to get a separate billing notice for the anticipated cost of your medications for the year divided by 12. So if the insurance company anticipates you're going to reach your $2,000 out-of-pocket limit, then you would be billed approximately $166 per month. Okay, so that's going to be a separate payment. Individuals that are enrolled in these plans, I think I have it on the next slide here, are not going to pay the pharmacy. The pharmacy and the health insurance Part D plan carrier are going to communicate, and it's going to be recognized that an individual is participating in this payment plan. The pharmacy actually will get paid by the insurance company, and then the insurance company will bill the individual. Okay. A beneficiary, a person that's participating in this plan, can opt in to the plan at any time, and you can also opt out, so you can cancel it. An insurance carrier cannot involuntarily terminate the payment plan program if you have to be given at least a 2-month grace period before a person is terminated from just the payment plan program. Okay, meaning they don't get billed, now you have to pay at the pharmacy. The insurance carrier cannot terminate a person's enrollment in the Part D plan for non-payment towards your prescription payment plan copays. So let me try to break that down, because that is a little confusing. You have to pay your prescription drug premium, the plan premium. So to be included in that plan coverage, ID card active, you have to pay your monthly premium. And then if you're taking high cost meds, you can enroll in that insurance company's prescription payment plan. Okay, from that prescription payment plan, you are going to receive a separate billing notice, separate from your premium, for the cost of your medications each month. If a person does not pay that cost of medications, they, after a 2-month grace period, will be removed from the payment plan, gone, but they're still insured under the prescription drug coverage. But now that individual, instead of paying the insurance company that prorated amount, now the individual has to pay that cost of medication at the pharmacy, depending on what is owed. So hopefully that makes sense. It's a little complicated. Like I said, this is a really new concept. We really have to keep an eye out. Be kind to your pharmacist, because I'm not sure how much of this information is being communicated to the pharmacy world at this point, and this is going to be huge. Let's just keep our fingers crossed that computer programs, information is all just moving in a solid, nice little highway of communication between the two, because this could get a little messy come January and February. If a person switches a prescription drug plan, so if you have a prescription drug plan with XYZ insurance carrier, and then, in a couple of years, you change to a different prescription drug plan, you would have to re-enroll in that new insurance carrier's prescription payment plan. Okay, we talked about all of this. The thing to keep in mind, if you are not enrolled in the prescription payment plan and you go to pick up your medications and your medications are over $600 retail cost, the pharmacy has to provide you with a notice stating that, they call this standard notice, I'm going to have to read this, the Medicare prescription payment plan likely to benefit notice. It's a standardized notice that just makes you aware that you may find a benefit in enrolling in this prescription payment plan if you'd like to with your insurance company. The pharmacy cannot enroll you in that plan. You have to enroll directly with your prescription Part D insurance company. Okay, so the pharmacy is just going to make you aware that that's available. If you're not enrolled in the plan, you're going to have to pay the pharmacy. Okay, so it's not until you're enrolled in the prescription payment plan that you no longer pay the pharmacy for your meds, and now you're paying your insurance company. And again, if we take a step back, you can see on the insurance company's side where now the insurance companies are having to most likely create all new departments to help support this particular new benefit that's being offered. This is huge. So this is a big driver in the cost of these prescription drug plans, absorbing that extra cost. Changes ahead. So we're nearing the finish line. I hope you've made it this far. Bottom line, we are going to have to be more aware than ever, specifically on what changes are occurring for your particular prescription drug plan coverage, whether that's standard or a standalone prescription drug plan, or if it's included in your Medicare Advantage plan. Right? It's going to be extremely important if you have a relationship with an independent agent or agency, really work with your agent or agency to help allow them to help guide you on these transitions. I know here at Blaze Senior Concepts, we are offering a lot of seminars, a lot of emails going out. We've tried to be really proactive on this. As agents, we're experiencing some changes too, where especially on the standalone prescription drug side, many insurance companies are eliminating an agent's compensation, how we get paid. You as the beneficiary or the client usually don't pay for our services. We get paid by the insurance company. So some of that is changing on the agent side. So be kind to your agents too. Many of the insurance agents out there are local, independent individuals that are in your community. They're just trying to do the best they can for each of their clients. So this is just a time of a lot of change. We all have to be kind to each other. We're going to get through it. It may be a little bumpy, but that's why it's so important that you've been watching this video. Share it with your friends, like, subscribe. because this information you need to know in order to make an educated decision on your coverage moving forward. You need to know what to anticipate before you have to make the decision, because the annual enrollment period here in the fall is really short. And if you're trying to absorb these changes and what you need to do and what you need to be aware of, and you're trying to do that all within a really short time frame, that's going to be challenging. So give yourself some grace, start digging into this. Again, if you work with an agent, lean on your agent to allow them to share this information. Make sure that if they're offering seminars, if they're offering educational pieces, take advantage of it. They're doing that for a reason, because they know that this is going to be important. This is something that we all need to keep an eye on. Some final tips and takeaways. We already talked about be proactive, okay? Begin sharing this knowledge, absorbing it, watch this video again. Consider all your options. So there is a good chance that maybe your current coverage, exactly as it is today, is not going to be offered next year. So you need to become open to some changes. And change can be good as long as we do the research and make sure it's a good fit for you. Another thing, you are all aware that you get bombarded by commercials, phone calls, mailers, emails from insurance companies wanting you to change to their plans. This is going to be an extremely important annual enrollment period where you be really cautious of what it is if you pick up the phone and or someone calls you and begins to talk about you could get this benefit or this change, or if something sounds too good to be true, it very well may be. Okay, again, that's where it's so important to have an agent, have a resource where you can call them and walk independently through your options to make sure if you're going to make a change, that's what change you need to be making, that you're okay with it, that you're walking into that situation with all aspects feeling comfortable. Keep an eye out for information as it's released. This is still moving. Like I said, we are taping this in early September. There's a lot of information that hasn't been released yet. October 1st, that's when we as agents and the whole insurance community can begin sharing information on the new plans. We'll have a much clearer picture from there, but for now, just keeping an eye on your information. Again, thank you for taking the time out to listen to what to anticipate in changes for the Medicare Part D program in 2025. Like, subscribe, share. Last I checked, there's not a lot of information about this. I'm not seeing a lot on the Medicare side other than there are going to be changes in the $2,000 out-of-pocket cap. Not a lot of details outside of that. So again, it's really important that you become aware of this. If you found this video helpful, make sure you share it, get the word out to that. And we can help. If we can't help, there are a huge agent community that's their whole goal with their agency is to assist individuals in navigating this world of Medicare. So hopefully you found this informative. Keep on the lookout for additional emails or not emails, but videos, and we'll see you soon. Thanks.